let's talk a little bit more about prescriptions and how those work under each option. So how does that prescription coverage typically work differently on original Medicare versus Medicare Advantage? And I guess what is the formulary issue that catches people off guard once they already are enrolled in a plan? So it's like a two-part.
Yeah, it's a two-part question. But so first of all, the difference is if you're on original Medicare and you want drug coverage through the Medicare program, you're going to get a Part D prescription drug plan if you want to remain on original Medicare.
Okay.
So those are standalone prescription drug plans. Depending on your service area, is going to dictate what is available.
Is that through a private company or is that
private insurance companies that have to follow Medicare's regulations?
So what you're saying is you can't get a Medicare drug plan. You can't get a Medicare Part D.
Federal Part D.
Right.
Part D is the privatized prescription coverage.
Got it.
Approved through Medicare's.
Similar concept. They have contract. They've been hired to do a job, right? So they're
very similar to Medicare Advantage plans. They got to submit all their documentation yearly, get the plan approved. It's a year contract. Yep. And they got to yearly update these things.
Okay.
They got to follow all of Medicare's rules and regs. And so that's the original Medicare option. Contrary to that, if you go the Medicare Advantage plan route, you can go with an MAPD, Medicare Advantage prescription drug plan. So it has a prescription drug component built into it. Mm. So that's going to be very similar. It's going to follow have those same regs and rules. We've seen, depending on the service area, those MAPD drug benefits typically be a little bit more competitive than some of the standalone Part Ds, and we think that's because they try to make it more attractive for people to want to enroll in that, because that's a full package, right? You're getting health and drug coverage all in one. Where over here, you're just getting the drug coverage standalone. And that's sometimes a benefit, sometimes it's a con, right? You can every year customize just the drug component and leave your Medicare supplement there, right?
Yep.
Not touch that. But that's what those two options, that's what they look like. And so what's the big...
So before we get to the formulary surprise or trap, is there any... You said they operate very similarly, but is there any difference between like how much they cover? Like what does that look like as far as the drug plans themselves versus like a standalone Part D, Medicare Advantage? Is there going to be differences in how much they pay or what levels the prescriptions are considered? I mean,
well, they're all going to have to follow the same basic rules set by Medicare and have the same base level of coverage, but they can customize their plans based on formulary, one way, right? So it's a list of covered prescriptions. They're going to have to cover set amount of prescriptions in all clinical categories, but they may cover different ones, right? And so depending on somebody's prescriptions they're taking, one may be more competitive than another plan based on the set of approved meds on their formulary for each clinical category, right? That might match your needs better. Makes sense? So every plan will have a formulary, and every plan is going to have a list of pharmacies that are either in-network, standardized in-network, or preferred, get a better deal there. It's like, again, preferred in-network, standard, and then out-of-network. Places that they're just not contracted. Similar to a network with, again, your doctor's office. And so those places you wouldn't have any coverage. So you pay the full price for your prescription at an out-of-network pharmacy. So that's what's going to vary, how those pharmacies are listed, list to cover prescriptions, premiums on the plans, deductible. Does a plan have a deductible? So that's what you got to watch out for, be aware of going into it and looking for one that's going to best fit your needs.
And how about any type of like quantity control or access to the prescriptions themselves? Like, is there any type of regulation there?
It's a great question.
On either one, or is it on both?
On both. You're going to have that. Yep. You're going to have different ways that the insurance company can limit access to prescriptions and control cost. So you got prior authorizations. We've already talked about that. Very similar on the healthcare side. Right. Doctor's got to say, yep, Betty Joe needs this prescription because of X, Y, and Z. And that's got to get submitted to the insurance company. They got to approve it, and then they can go and get that filled, right? Not really a big deal.
Right.
What's interesting is we barely ever see any issue at all with those. Correct me if
no.
you say, hardly ever. Those are typically done pretty well for some reason. Contrary, on the health side, we see more issues from that billing department for whatever reason. So prior authorizations, you've got, as well as that, quantity limits. This is something we see. What that's designed to do is just limit the amount of the quantity that you can get of that prescription in a given time frame.
Mm.
So think about like a narcotic, somebody
Right.
taking a Norco.
Mm-hmm.
There's been a crackdown on those type of prescriptions for past
Right.
number of years, right? So maybe that insurance company limits it to a 30-day quantity, and they'll only get you 2 a day, right? Now that might vary though from company to company, right? So you might be on a torvastatin, and somebody's got a quantity limit on a torvastatin for whatever reason, or lisinopril. You're like, what? Why? This is like common med, but one company may limit
Right.
to 30-day supply, where another might allow you 90 days. And that may just be more of a convenience for you, right? Because now you can get a 90-day supply for some of these maintenance meds. Then you've got the next step, the next way they limit it, which is step therapy. And so the insurance company may have your Linzess covered on their formulary, but they may require you to try a less expensive alternative in that clinical category before they will actually cover this Linzess, for example, right? And that's a way they're going to control cost. So it maybe you've already tried an alternative. Doctors got documented proof. They tried this med, they tried that one, didn't work.
Right.
So that documentation needs to be insurance company. They see what they need to see. Now they're like, okay, we'll pay for this drug. So that's kind of the process that has to be gone through in that situation. So that varies though from company to company. All these items I just mentioned. So we want to look deeper than just, is my prescription covered?
Right.
Right. And is my pharmacy a preferred pharmacy? There's a little bit more depth. And we can get even more granular than that when it comes to prescriptions being covered or not covered. But yeah, I think that's a good high level view.
Yep.